issues, panhandling issues, and kind of talk a little bit about our partnership with CenterPointe, and mainly the show today is CenterPointe and what they've been doing for the homeless population, and able to answer your questions. We know it's going to be ever changing here in the downtown area specifically, and I know a lot of you as business owners, employees, companies have varying levels of interaction with our homeless community downtown, and kind of want to go from there. I mean, really to get started, our organization with the Downtown Lincoln Association has worked with this for a long time. We're no exception to homelessness, obviously, in an urban center, as lots of cities deal with it. About 13 years ago is when I started working with this. I was about 7 years old when I was with DLA and had to work for a campaign to educate the community on the difference between crisis and chronic homelessness, and educate them on panhandling and different things like that. We had a group of individuals that were panhandling, and the businesses were concerned a little bit on that front. And so we sought out to educate on the best ways to give your money downtown, and worked with extensively with the Homeless Coalition for that. Different groups around the community, including CenterPointe, the People's City Mission, Matt Talbot, places like that. And it was kind of an eye-opening campaign where you realized, you know, there's a wide range of not only just homeless in our community, but the needs that are needed through that. And it was really good to make the community aware of, again, the difference between panhandling, homelessness, crisis, chronic. There's also some loitering issues, which we wanted to make clear that were not necessarily in line with homelessness. We didn't want people to clump that together. And it was a pretty good campaign to raise awareness. It didn't really go the next step, though, where, yeah, you could raise awareness all you want, but we still had people on the streets that a lot of them needed help. You know, some of our business owners were intimidated by that, but once, you know, a lot of them got to learn and meet some of these people and realized they needed help, and we really wanted to take that next step. And fast forward about, I think this takes us to about 4 or 5 years ago, Cole. That was when Cole was 3 years old when he got started. And we partnered with CenterPointe to have more of a focus on having a outreach worker work more closely with the downtown population, help meet these people, determine where they need help, can they be placed somewhere, are there programs to utilize, and just kind of get to know the community and what the issues are. And also, as Cole's done and Matt's done, is work closely with our businesses. I know, again, we've had some varying issues throughout downtown, and again, I think it's really important to note that homelessness and panhandling and again, loitering, they're all very different things, and we don't want to clump those together, and we want to educate the community on how to work with all of those types. So we really wanted to kind of continue to educate that and move forward. And really today, I think Cole and Matt will be able to hopefully answer a lot of your questions after Cole and Matt do their presentation. I think, yeah, we want to open up to some Q&A. We did get a lot of good questions beforehand that Cole has seen. And we want to go from there. So with that said, I want to introduce you to Cole, who's been with CenterPointe, and I'll let him kind of give his backstory, because he can do it better than I can on how he got involved, and go from there. So Cole, take it away.
Yeah, so thank you, Todd. You know, I think you said it pretty well. You mentioned how at one point or another, all of us, everybody on this meeting, and really anybody in the community, comes in contact with somebody that is experiencing homelessness. So you really did a good job of showing how it really is a community issue. And, you know, I really appreciate that, because while CenterPointe's out here hitting the streets, working hard, housing people, we can't do it all on our own. And Lincoln, luckily, has really done a good job of recognizing that and really moving forward, being progressive, and coming up with new methods and using the latest research out there and working together as a community. So it's not just CenterPointe working on this, it's Matt Talbot Kitchen, it's Cedars, it's the People City Mission, it's the Hub, it's all the agencies in town. And I think that's really neat about Lincoln is how well we all work together. So a little bit about myself. I'm from York, Nebraska, and moved to Lincoln to go to college at the university, and kind of started doing some outreach type work with Skate for Change. I don't know if anybody on here has heard of Skate for Change. You've probably seen the group of kids skating around downtown. I know it's caused some issues in the past, but that's how I kind of got started. And then I met Matt, who kind of really paved the way for what street outreach in Lincoln is today. Matt really, made all those initial connections with businesses and organizations. And then I was able to kind of just fall in when CenterPointe and DLA partnered, and started working a little over 4 years ago now. And it's gone really well. We've housed a lot of people who have been downtown and in Lincoln homeless for a long time, or homeless off and on for a long time. So that's just a little bit about myself. Matt, do you want to share a little bit about yourself quick?
Sure. I'm Matt Bartnowski. I'm the street outreach coordinator for CenterPointe. I oversee Cole's position, as you could tell by his brown nosing just a second ago with me. I've been doing it for 7 years. I worked with Terry a long time ago when Cole's position was kind of starting out, when the first talks of that were starting out. And it's been huge. I don't think I can say thank you enough to DLA because it allowed me to focus more on the rest of the city where Cole could work downtown. I think Cole kind of covered everything, though I don't really have much to say. This is more Cole's thing. I'm just here to kind of throw in some things, and I just wanted to see some of the people I know, like Dan and Sean and Todd. That's all I'm here for.
The social connection, huh? That's all you're ever there for. Matt knows all the good spots for like good candy and good lemon bars and good coffee all throughout town. So let's talk a little bit about what Lincoln is doing for homelessness. So Lincoln uses a process called coordinated entry, and you guys don't really need to know that, but basically it's the process of somebody becomes homeless, we do a housing assessment with them, and then they get put on this housing priority list. And we make sure to throw in the word priority in there because it's not a first come, first serve list like a lot of people might assume. I know Matt and I constantly get calls, where am I at on the list? Where am I at on the list? We usually don't have a clear answer for them because it's based on priority. And the reason for that is we're trying to get the most vulnerable populations housed and off the streets. So the types of things that give you priority points are things like a disabling condition, a chronic homeless status, which is when you're homeless for 12 months straight or more, or homeless for 12 months in the last 3 years with 4 episodes of homelessness. If you're pregnant, if you're fleeing domestic violence, things like that give you priority. If you're over the age of 60, things like that give you some priorities. So we're really trying to focus on the idea of like who is most likely to die on the streets and how can we get them housed as fast as possible. Because the simple truth is we don't have enough resources to house every person in the community all at once. It does take time usually for people to get housed. And the only emergency shelter in town is the People City Mission and the Friendship Home. Friendship Home serves people fleeing domestic violence. So coordinated entry, every week, all of those organizations that we've been mentioning get together, and including Matt and myself with CenterPointe, and we basically try to come up with housing plans for all of the people on the list. Now, on any given day, there's approximately 500 people in Lincoln who are either street or shelter homeless or fleeing domestic violence, which I don't know about you guys, but when I moved to Lincoln, I never would have guessed there was that many people who were homeless in Lincoln. So that's always, it's been eye-opening for me, and to see the community come together and try to do something about this is really neat in Lincoln. So I want to talk a little bit about those 500 people and what homelessness really looks like. So I know for us people in the downtown area, it's easy to, say, oh, it looks like panhandling. It's these people downtown. It's this person yelling and hollering across the street. It's this person walking down the street with a sleeping bag or whatever it may be. But it often looks like many other things. So HUD, the government, has deemed fleeing domestic violence as sufficient enough to be considered, and not necessarily homeless, but to be on this list. They don't have sufficient housing. So that's an example. And often when people, usually women, are fleeing domestic violence, they're going to friends, going to families, sleeping in hotels, motels, maybe sleeping in their car. A lot of people in Lincoln are homeless in their vehicles, sleeping in parking lots, sleeping on streetways, things like that. And then, of course, we have the People's City Mission, and Matt, maybe you know, but I don't know how many people are out at the mission. Probably like 100 or 200. I don't know. It's just a rough number, rough guess.
If you're going to share your screen with that point in time count, it says the sheltered.
Oh yeah, I'll do that. Okay. Can everybody see it? So which one are we on here? Subpopulations. So, okay. These numbers right here that you all can see are people who were homeless last January 2020 with children. So there were 57 households with children experiencing homelessness in Lincoln during that time. And then did it say sheltered on there? Oh, yeah. Most of those families with children were in the shelter. So that's already 186 in shelter. No, 120 in shelter. And then persons without children. So most of the people where's the one I want? Most of the people that we see that are homeless are single adults. Is this it? Yep, here we go. So here you start to see, a lot bigger numbers. There's 211 people in the shelter at that time and 41 people at that time unsheltered. So that means the people living downtown. That means people living out at campsites, living in their cars, things like that. And then just give you a little snippet of some subpopulations within the homeless population. Out of all those numbers, so there was about 457, I think, last January was the number. 107 of those people had a SPMI, a serious persistent mental illness. And then 74 of them had a substance use disorder. One responded that they have HIV or AIDS, and then 54 of them were adult survivors of domestic violence. So that's not all the numbers, though.
I do think it's important to note on that when we go out for point in time, it's all what those individuals are reporting to us. Mm-hmm. So some people aren't going to say if they are comfortable, if they have a serious mental health issue or substance use issue.
Right. Yep. That's a good point. Is it my face again? My video? So that's kind of what homelessness in Lincoln looks like, and then a little bit about what the community is doing. So Lincoln has several different housing programs. So when we meet on every Thursday, we go through this list of people, And the types of housing programs that these people are getting into is not only Section 8 or Lincoln Housing Authority, but also CenterPointe has long-term, more permanent type housing, which is housing that's going towards these types of individuals that are downtown who are chronically homeless, live with a mental health illness or substance use disorder, things like that, people with more higher priorities. And then CenterPointe also has our GLIDE program and some other rapid rehousing type programs, which are more short term, like only up to 2 years. So the idea is it's people who are going to have a little less needs. They're going to be a little more stable by 2 years and be able to live independently. That's the goal. Doesn't always work that way, but we do have more successes than not. So, and then we have a program that serves families. We have a program that serves transition age youth, which is anyone 24 and under. And I think that's all of our housing programs. Oh, we have a veterans housing program. And so I don't know if maybe some of you have heard this, but Lincoln did something really neat 2 winters ago. We hit what is called functional zero for homeless veterans or homelessness in the veterans population. So what that means is we have basically hit the number 0 for any veterans experiencing homelessness. And if a veteran did become homeless, there would be a program and a voucher for them to get housing immediately, basically, is what that's saying. So there are still a couple of veterans who are homeless, but that's because they've burned the bridges or gotten evicted and caused their own problems, and it makes it difficult for them to get back into housing. So that's a little longer process, but Lincoln has hit functional zero, and only a handful of cities in the entire country have been able to do that. So it's really neat that Lincoln can say that we've hit functional zero for veterans homelessness. And now our next goal that we've kind of been focusing on is ending chronic homelessness, or getting to functional zero with chronic homelessness, which again is that 12-month mark for how long they've been homeless. And Matt Talbot's another really big heavy hitter when it comes to housing. They have their own outreach program and their soup kitchen. So they do a lot. A lot of people we serve go to Matt Talbot, and they've stepped up and they have lots of housing opportunities now as well, which is really, really neat. And Matt and I work closely with Sarah, their outreach leader, and all their other outreach workers and case managers, staff. So I think I've touched on kind of coordinated entry, what it is, what the community is doing, and I guess maybe I should have started with this, but let me talk a little bit about CenterPointe so you're all aware of what CenterPointe does and then how Matt and I kind of fill in our roles. So CenterPointe historically has served in the mental health field, but something that CenterPointe has been very ahead of the game on is being a dual diagnosed, or we work with mental health and substance use disorders. So we recognize that usually they go hand in hand. It's not just mental health or it's not just substance use. And CenterPointe, since we started back in the 70s or 80s, has always believed that and always worked on that. And most behavioral health fields are still kind of catching up to that idea, I guess. So it's really neat that CenterPointe is right here in our community and we're kind of ahead of the game. So CenterPointe, we have our outpatient facility where Matt and I are located, and what we do at our outpatient facility is we have outpatient treatment for people with mental health and or substance use disorders. We have case management to get people connected to resources to hopefully get them off the streets or connected to healthcare or connected to jobs, employment, income, whatever that may look like for them. And we have peer support. So I'm guessing not many of us on here have heard of peer support, but Matt and myself are actually peer support specialists. So what that means is we have lived experience with mental health and or substance use and or homelessness. For myself, for example, I have lived with depression for over 10 years now, major depression, and I'm able to use that experience and connect with the people that we work with, because the idea of outreach is peer support, wherein we want to build a relationship with the person. That is me and Matt's biggest goal, is connecting with the people that we serve. So when I go downtown and I talk to people, I really try to get to know the person and not necessarily just jump into, what do you need? You know, what can I do for you? I try to get to know the person and then slowly over time figure out their wants and needs. Because what we found is that's a lot more sustainable. If you just go up to a person and start signing them up for housing, signing them up for jobs, they're going to get overwhelmed. Stuff's not going to get done. But if we take things one thing at a time and get them housed, and then in a stable location, then we can focus on kind of their other needs. And so that kind of brings me to the idea of housing first, which Lincoln has adapted along with most of the country. Housing first is the idea, just how it sounds. You get the person housed as quickly as possible so they have their basic needs being met. And then you focus on what else is going on. Is it mental health that led to your homelessness? Is it substance use that led to your homelessness? Was it a loss of job? Was it a terrible back injury, a wreck? I don't know, whatever it is. Let's get that figured out so you don't become homeless again. While we're helping you pay for your bills, let's get you back on your feet is the idea. So CenterPointe, we have our outpatient facility, and then we also have a couple inpatient facilities for short-term treatment, long-term treatment. We have a day rehab facility. We have some pretty intensive daily contact type programs. And a couple years ago, we also expanded to Omaha. We took over a short-term and long-term treatment facility in Omaha, which is really neat. So that's kind of what CenterPointe does. Oh, and recently we got a huge grant, CCDHC, is that right, Matt? So that allowed us to expand to physical health as well. So CenterPointe is actually even taking another new step here, and we're getting away from just behavioral health or mental health field to whole health. We want to address the whole person's needs, and not just their mental health, not just their physical health, not just the substance use, not just your homelessness, but the whole person is the idea. Let's take care of you as a whole individual. So we have mental health services, substance use services, and now physical health services at our outpatient facility, which is really, really neat. And we've had kind of a slow time making referrals with those. So if any of you know people with physical health issues who maybe don't have insurance or are low income, you can send them our way. And we can at least get them connected if they don't qualify for our services, which they probably will if they don't have insurance. We also expanded services to family and youth as well, which is really, really cool for me to see, because I love the idea of prevention rather than intervention, which we're also doing some projects with prevention as well, but that doesn't really affect us right now. So that's what CenterPointe does. And that's what we do. So specifically though, Matt and I are usually, if we're not doing documentation or not doing meetings, Zoom meetings, we are literally hitting the streets, hitting campsites where people are sleeping and staying, trying to build relationships with these people, trying to figure out what their needs are and how we can best support them to get them off the streets and living independently is the idea. So I want to kind of open up a discussion, I guess, to all of you businesses, because like I said at the beginning, like Todd said, this is a community issue. And, you know, Matt and I are doing what we can, the city's doing what they can, all of the other agencies are doing what they can. But the reality is we just simply do not have enough resources to help everyone all at once. And especially during COVID, you know, COVID-19 in 2020, we're seeing a lot of people reaching out for assistance. Thankfully, we got some government funds, and Matt and I have been able to prevent a lot of people from becoming homeless because we use those funds to pay for their bills if they lost their job because of COVID and things like that. So there are also resources out there. If you know anybody who's struggling to pay rent because they lost their job because of COVID, send them our way. We can get them connected. So anyways, I want to kind of start the conversation of what we as downtown businesses and leaders can do about homelessness. And I think the very simple first step is something that CenterPointe has adapted, and that is using person-centered language, or another way you can word it is person-first language. So we're all leaders here in the community, right? You're a leader of your agency or your organization, and Matt and I are leaders in the behavioral health field in Lincoln. And so we all touch and reach out to many, many other people, right? And so what we see in the mental health field is there's a lot of mental health stigma. And one way to fight that stigma is by simply using different language. So CenterPointe actually has a language guide. And so, for example, a language guide that we kind of refer to, it's kind of just come natural by this point because I've had 4 years of practice at it, you know. The idea of person-centered language is that we should focus on the person's strengths, assets, and abilities, not things like their diagnosis or their deficits or what's wrong with them. We should reflect our respect and unconditional positive regard and not our judgments and opinions. We should be clear, understandable, and free of jargon, not difficult to understand for individuals and services. We should be based upon evidence-based practices and not confusing data, speculation, or assumptions. And we should focus on a sense of commitment, hope, and opportunity. That's another huge thing with peer support as well. Our peer support specialists always focus on hope and focus on what you can do as a person, not what you cannot do. And so an example of this is let's say you are referring to a person maybe walking downtown and they're flailing their arms around, they're talking to themselves, they're yelling, they're making gestures at people as they walk by, and you go, you know, boy, that person's really schizophrenic or something like that. The idea of person-centered language is that you put the person first. So maybe you would say, boy, that person over there really seems to be struggling with his mental health or with maybe schizophrenia or something like that. Again, we don't want to assume. We don't know what that person has, what their mental health is, or if they're using a substance or anything. We don't know for sure. So we don't want to assume things. One thing that Matt has been working hard on lately, and I've also been working on, is trying to get rid of words like crazy in our definition. So at the bottom of the page here, it says, for example, wow, that's crazy. I can't believe it. An alternative, for example, would be, wow, that's wild. I know Matt has been saying wild a lot lately, and it's every time he says it, it really sticks out to me. You know, it does make a difference. And it's as simple as avoiding or not avoiding, because we don't want to avoid the conversation, but getting away from that stigma. When you say words like crazy or schizophrenic, it implies that that person is lesser than or like you're not giving them the full respect and dignity that they deserve as a person first. I hope that makes sense. I'm trying not to make this too complicated. But so us as leaders in the community can simply change our language first. And I think that really goes a long ways. I know that when I started at CenterPointe, I didn't have this kind of language. I was a very empathetic person though, so I did my best to adapt it, and I learned over time. It does take practice, and you'll make mistakes, but you'll get better as you practice. And so the reason I bring this up is because I know a lot of you downtown businesses, you see people flying signs or panhandling outside your businesses, or people loiter outside your businesses, and you know, this is probably causing some issues for your customers who are wanting to come in, you know, and into your shop. And so I've had several businesses ask me, you know, what can you do? What can we do? And my first response is usually, you know, have you tried to talk to the person? And obviously, you know, it seems obvious, like, yeah, just talk to the person. Now I understand the fears of, well, what if they're having a mental health episode, or what if they're high, what if they're intoxicated? My advice would be first to always try to talk to the person. I usually don't wake people up if they're sleeping. That's just me, because I don't feel comfortable with that. I don't want them to wake up and immediately be triggered or anxious or upset with me, because then you have to put your de-escalation skills to work. So I usually don't try to wake people up. So if somebody's sleeping outside your business, if you're comfortable and you're willing, give them time to wake up. And when they wake up, go say, hey, my name is Cole, and I just want to introduce myself. This is my business right here. I'm wondering, who you are and what I can do for you. Or, again, I'm not saying you need to connect these people with resources, but you could simply say, have you ever met Cole Dickus with CenterPointe, or Matt Martinowski with CenterPointe, or have you ever heard of CenterPointe, or is there anything I can do for you? Otherwise, if there's not, would you mind moving along, or moving down the street, or something like that? That, to me, is the simplest approach. Now, I know that people's concerns are, what if they get upset? What if they're triggered? And so I guess that's a good time where Matt and I would put our skills like de-escalation to use. And so when I think about that from a business owner standpoint, you all have good customer service skills, I assume. I'm sure you all are. I'm sure you all preset to your employees. The customer comes first, right? I know when I worked at the movie theater downtown, it was always the customer, the customer, the customer. And so that's your biggest concern. And I don't know, Matt, do you want to try to help me in this point here? I feel like I'm rambling. Or give your input, and then we can move on to the next.
Really, for me, I have this problem. Remember River Phoenix's character in Stand By Me? Where at the end, they talk about getting stabbed, and because he was just trying to help somebody. And I have a terrible sense of humor, and I always make that joke that that's probably what'll happen to me. But I have no real issue walking up to anyone and talking to them, but it's all about your comfort level. Because I fully understand if you're not comfortable talking to someone, but realistically, like Cole's saying, it's just human interaction, humans with humans. And the more you get to know someone just with little tiny things, the easier it is for you to say, to have that conversation of, some people are getting upset that you're sitting here, or I don't know that I would word it this way, but it doesn't look so good that you're sitting in front of my storefront, or whatever, however you would want to word that. But it's a lot easier when you know someone and you can approach it in a friendly manner, as opposed to when you don't know someone and you just come out and are barking orders at them.
So a lot of times, I think there's something to point out there, that the way you're able to do that is because it's the same person consistently, right? I know when I see people panhandling, they're usually in the same spot, or they rotate to a few different spots. So you businesses are probably seeing the same people over and over again. And then occasionally you might see some new people, or you might see some new people in new places. So if you're able to, you could try to build a little bit of a relationship with that person, is what Matt's saying.
What have you seen downtown, is so people understand on what types of individuals you work with, whether it's, again, panhandling, homelessness, loitering, and when what's legal, what's not legal, what to be concerned with, when to call the police, or when to call DLA, when to call CenterPointe, and what's the makeup of downtown look like, and has that changed drastically since COVID?
I think there's a very broad range of people. There are there's extremes of both ends. There's very, very, very simple people who totally stick to themselves. You don't talk to anyone, don't cause any problems, nothing at all. It's almost like they're not there. And those types of people usually kind of fall through the cracks, and that's why they're homeless for so long, is because they don't reach out, because they don't have connections. So there's kind of those socially isolated individuals, I guess. And then on the other extreme, you have some individuals who maybe are using meth on a regular basis. And, they're high for a long time. Meth has a long lasting effect. Uh, and that's going to affect their behavior, obviously. And so, or maybe they're having a mental health episode and they're very sporadic. They're yelling, they're hollering at people, they're scaring people away. People are walking across the street from them. You do see extremes of both ends. And then, of course, you have people in the middle of the road, just regular ass people like you and me, and who are just, they lost their job, they became homeless, now they're kind of stuck in homelessness. What can we do to get them off streets and back to independence? It's that big. So you see the whole spectrum, really. Since I've started at CenterPointe, it seems to me like we don't have as much of that far end of the spectrum where people are having really bad mental health episodes. I remember when I started, I got a lot of calls from LPD, from the fire department, from businesses, from the library. Hey, this person is like yelling and screaming, they're causing fights, they're causing disturbance. I used to get a lot of those, and I don't get near as many anymore. And when I'm actually downtown myself, I don't see those types of behaviors near as much. And I think the reason for that is because some of them have moved on, but we've also housed a lot of those chronically homeless individuals. Well, that wasn't very person-centered language of me. Those individuals who are chronically homeless. So we've kind of solved some of those issues. Now, we are starting to see kind of a new swing of people who are chronically homeless, and hopefully we can get them into housing here soon in the next kind of wave of housing openings that we have. Just this week, I actually worked on documenting people up so they can get that chronic status, which gives them a lot of priority points to be housed. So I feel like seen a positive change in downtown since I've been working. Now, obviously, that's easy for me to say. Maybe I'm tooting my own horn. I don't know. But I even get the same type of feedback from like places like the library. They're saying, hey, Cole, you have these connections with these people, and now we have these connections with these people, and we can just say, hey, so-and-so, you can't be sleeping in here in the library. You got to stay awake, or hey, so-and-so, you're causing kind of a disturbance, can you keep it down a little bit? It's because they built those relationships with the people. A perfect example is Paul, the security guard at the library downtown, their main security guard. He's been so wonderful. He makes referrals to me. If I'm looking for someone, he'll help me reach out to people. He'll get me connected with people. And I've had this conversation with him of just, hey, what can you do? Well, you can, not just enforce the rules, but you can try to get to know the person a little bit and figure out how can we avoid this in the future. Because you're probably going to come back to the library, or you're probably going to come back to downtown or my business area. And so what I've seen since Paul and the library have taken steps to really build relationships with the homeless population and people who we think are like kind of in this population, they've had a really positive impact. And they actually keep reports of incident reports and whatnot, and they show me how it kind of goes up and down and with what different times. And it's kind of funny. This is just what I've noticed. I've noticed when we house some people, they like have a dip in their incidents and whatnot, which is kind of neat. And last May, so May of 2019, I remember Paul was showing me the reports. And he's like, Cole, what happened this month? We hardly had any incident reports. And I was like, we just had this big grant, we housed a lot of people. So there's not people hanging out, down here at the library. And that was pretty neat to see and to tell him, that, hey, we did something, we made a difference here. Does that kind of answer your question, Todd?
Yeah, no, I appreciate that. I think it's a good point to bring up, and I know you don't want to toot your horn, but I will. I mean, I've seen your numbers, and anecdotally, obviously being downtown every day for myself, I've seen shifts over the last decade, and this has been the most positive, lasting shift. You mentioned, the longer term effect of getting to know them and trying to place. If we try to just kick people out, inevitably it'll just be replaced and come right back. If we truly try to help them and get them placed in housing, which you've done, and we have countless numbers of placements that you've done downtown, it definitely has a lasting effect. So that certainly has helped. Again, it doesn't mean it's alleviated. It doesn't mean the perception of people's safety downtown's changed, certainly. It only takes a couple individuals for people to think it's changed downtown. That's one thing I've learned over anything else is, one or two people with a lot of sleeping bags and things like that, we can get more calls. But yeah, that answers the question. And, before, I don't want to take up too much time talking before we can open up for questions for other people. But I think it brought up a good point too, is why are they down? Why are some of these individuals downtown in the first place? Why are the people, deciding to sleep in front of storefronts and different places like that? With your experience with them, I think it's important to understand why they're there in the first place and how we can do it and what we can do to help them that way.
Yeah, that's super interesting. It makes me think of a human's natural makeup, their biological makeup, and how the brain works, and everything I've learned in college, and the science behind the human connection. And downtown is where people are. It's, whether we like it or not, there's going to be people panhandling downtown. There's going to be homelessness downtown, wherever people are. Same with out by North 27th. There's a ton of people out there all the time, and you see the same thing. There's panhandling out there, by Walmart and by those fast food restaurants and whatnot. So it's just, I think most of these people they've kind of been, pushed to the wayside, pushed out of society and left behind, and they're human too. They're looking for some social connection. I've found that I build a much stronger relationship with these individuals if I go up to them and sit down side by side with them and just shoot the shit with them, just talk. The relationship is way stronger than if I walked up to them and just say, "Hey, I'm Cole, can I give you some socks or water?" and just keep on walking. They appreciate that conversation, that connection so much. Most of them do. Now, obviously, I've again had the extremes, where we used to have an individual who I would walk up to him and just, before I could even finish saying, "Hey, my name's Cole," I would get a, "fuck off," or whatever. Sorry to be so blunt to you all, but there are people out there like that, and I understand. And so you kind of asked, at what point is a crisis? At what point do the police need to get involved? And so I guess in my mind, the process kind of looks like this. So you have someone, they're causing issues, they're causing a disturbance, maybe outside your business or at your business. And you don't necessarily want to call the police, or at least not yet. Maybe they haven't done anything technically illegal, I don't know. But there are obviously something going on, they're causing disturbance. So what you can do is try to talk to the person, see if they'll move along. And if that doesn't work, what you can do is try to reach out to Matt or myself. But I want to make sure that it's clear that we're not always available. We can't just, as soon as we get a phone call, we can't always be down there and ask people to move along. So that's why we encourage you business owners to be able to have that relationship with people if you can, if you feel safe. And then if Matt and I can't get out there and talk to a person in a timely manner, and they're still causing disturbance, they won't leave, then maybe that's the time to call the police, especially if they're getting aggressive. If somebody's getting aggressive and then they're getting hostile, don't bother calling me or Matt. We're just going to get there and see the same thing, and then we'll have to say, "Hey, you got to calm down. We're going to have to call the police." I don't think I would ever call the police on someone unless I felt truly unsafe. But I understand from a business perspective, when somebody's acting belligerent, and they're causing issues outside your business, you need to get them away so they don't hurt someone or so they don't cause any more problems or whatever. No, I don't think they're going to hurt someone. I've never seen that happen. I don't have any experience with that.
Butt in really quick.
Go ahead.
About that. So like Cole was saying, I would reach out to outreach first, whether that's him or myself or even Matt Talbot. You can reach out to them. I know Glenn and Stanford can get out sometimes. But then after that, before calling the police, with the new grant that we have for the integrated health, we also add on to our crisis team. So there's 3 dedicated crisis therapists and 2 currently dedicated crisis peer support workers that can come out at any given time to talk to people. Along with that, we're working a lot with LPD in those cases, trying to take, with like the social climate and everything that's happening, we're trying to take some of that weight off of LPD's shoulders by responding to those crisis calls. I'm also working with Captain Morrow from the Southwest team on some ideas for high utilizing individuals. So I would,
how can they get connected to that?
What's that?
Who do they call for that line? How do they get connected to that?
The crisis line is, and let me say sorry first, I don't have anything with me because I thought this was at 10:30, not 8:30. Because I'm great at scheduling. Our crisis line is, and I can put it in the chat too, but it's 402-475-6695. But that's the progression I would take. Any sort of outreach worker, crisis, peer support, and then LPD is a last resort. Because in the past, there have been times where we've been able to go out and talk people down, and then police interaction wasn't necessarily something that had to happen. But that's just all I wanted to add to that part.
Yeah, and those are good points too. And when in doubt, if any of you are uncertain, always continue to feel free to call DLA or email us. And obviously, with us working closely, we know more the direction to head on, whether it's crisis hotline, non-emergency police, or just, Cole or Matt, kind of going around there. One thing after this that we want to focus on is making it easy for you to understand that and put these business cards type sheets available to talk about who to call and when to call. And that's definitely one of our tasks with our safety priorities moving forward. In the past, we haven't wanted to do too much of that because we don't want people to be concerned like downtown's not a safe space overall, but at the same time, I think we need to make it clear that if there are issues, here's easier ways to get out there and what to do to help. So I think that's an important point to put together. And we have about 10 minutes left too. So I wanted to leave some time to open up for you all to ask specific questions regarding your business or your experiences and kind of open the floor to all of you.
Yep, go ahead.
Can I go?
Yeah.
Or no, Barbara, or you want to go first? Okay. So I have a comment, a frustration, and a question. First of all, actually I have 2 comments. One, I'd say, Matt and Cole, I greatly appreciate the shit out of you, and I just appreciate everything that you're doing in the community. So thank you for that, and thank you for being with us and sharing this information. It's been very fantastic. That's my first comment. My second comment is, Cole, you had used the term vulnerable populations. And in an effort for me to be a little bit better human, I'm doing my best to challenge what that means, because the folks that we're serving this is just a reminder for me, and I'm just going to share it. Vulnerable people or populations are not vulnerable on their own. It really starts with they're denied access to resources. And in this case, every level of every institution has basically failed them. So they don't have access. We talk about insurance. People don't have access to insurance, healthcare, mental health services, all those things. So being denied those accesses to those resources is what's making them vulnerable. They're not vulnerable on their own. So I just want to make that distinction real quick. So thank you for listening. Thank you, everyone. My frustration, but also very excited, is that, Matt, when you just said that there has been increased funding to a crisis team, I guess for us in the south of downtown, it's probably not any different than folks in the downtown area, is that we oftentimes witness mental health crises and different things happening in the community that I think the general population, even myself, we don't really know how to respond because there's just not a lot of resources, because what we believe is that the police are not the answer to every single issue that happens. And unfortunately, we resource the police, and that's all we resource, and that's our only response to these situations. So my frustration is that we need to probably more resources to go towards response teams like, Cole and Matt. I'm frustrated with having the police be the only option for community response, because I firmly believe that homelessness is not a crime. If you're homeless, it's not a crime. So thank you again for listening to me on that. My question is, you are doing such a very swell job in housing folks. I guess I'm curious to know, what are the challenges that you're seeing in housing folks? I know that there are few landlords that are probably willing to work with the homeless population. Are you seeing challenges there? Are you seeing enough housing available for folks? What are you seeing as far as housing challenges go?
Affordable housing is a big one with HUD funding, and all of CenterPointe's funding is like continuum of care housing funding, so government funding. And with that, we're limited on what we can pay for places. And then also landlords. And that's not to say there's landlords that aren't willing to work with us. There's some that do for a while, and then they'll get kind of burnt out because it is a difficult population to work with. So there's some that kind of cycle. They take their little vacation from this population, and then they come back and help some more. And there's some that just won't even give people a chance. So if you have landlord friends or no landlords, advocate is a huge thing. Also, Sean, we'll, I think it's Saturday. There's some of us will be at that discussion, that panel that you guys are having.
Yeah, that should be a good discussion.
Yeah, there's, I think this might be the third one where we are, just opening it up to the community to have those conversations around what does a community response look like that other than, calling the police. And I understand that calling the police at times is important and probably needed. How can we expand our response, and how can we get, the real challenge is we want residents to be comfortable in knowing what types of steps they can take before they have to, take that last resort of calling the police. Because I do think that there's other solutions out there, especially with such an amazing community that we have with all the different resources. And you talked about the assets and the strengths. We got a lot of stuff to work with. It's just a matter of, how do we do that as a community response?
So I think this.
Oh, sorry.
So I think this new grant that CenterPointe got with this crisis response is really going to address a lot of those types of issues. So it's still pretty new. We're still learning, we're adapting, but I think it's going to be a really good program. It's going to help. It's going to help just with stigmas around police and getting connected and building relationship with LPD and making it feel more like community.
Yeah, we need like 20 or 30 of you, Cole and Matt. Like that's who we need. That's what we need on the street.
Unfortunately, we don't, our positions don't make money back themselves. So it's all grants and, the DLA and your business is paying for my position, for example, that's how we have to rely on us having positions. So
Hey, real quick, this is Tara from the Children's Museum. I just wanted to, I see kind of a larger number of people hanging out in Centennial Mall than even in the past. It seems to kind of be upticking. And I know like we try not to call the police and have those conversations and stuff, but there's been some incidents where, children are being exposed to, like adults or men are exposing themselves to the families coming into the museum and things like that. And by the time we get out there, they're gone. So we can't call the police, we can't intervene, or they're just general harassment and things like that. I know we're only open 4 days a week, but I didn't know if there was any efforts to try to, or thoughts because of just being children that we serve. As that starts to spread, you see different families not wanting to come down here and things like that happening. So if anyone had any thoughts on like what we could do to help keep that part of the P Street, that inn safe for those children.
yeah, I know that myself, I've been trying to, when I go downtown, I always try to walk by the museum and check around that area because of what you just said, because there's children. And, I put their health and safety a little above anyone else's, to be honest. And so I try to kind of patrol that area, I guess, a little more. It seems to me like somebody took out those tables outside of what was Noodles and Company, I think. Since then, I've seen less people around. Yeah, there's chairs back now.
Yeah, there's chairs back there that's been back there. And we moved our parking so that they park in our staff lot, actually, just because I was hoping that would help them not have to come from the parking garages and walk past all that. So I moved the parking to be, so they park right next to the building. But when there's so many hanging out in Centennial Mall, and then around there, that's actually probably made things worse because they're they're coming from that side, they're pulling in, so people are coming up to their vehicles and things like that in our parking lot.
That's interesting. I don't know if I have a perfect response for you.
Yeah, and I absolutely don't expect you to. Yeah, I just was, as we were talking, I would love, like I said, I 100%, they're not, they're not criminals. We need to find them help and stuff. I just need to figure out a way to keep the children and family that are coming to visit safe as well.
Yeah. So I guess this kind of brings me to a point I wanted to bring up, and it's something that Topher and one of our past peer support program directors were working on. Topher is CenterPointe's CEO, so you all know. We had actually started the process of gathering information from those that we serve in the homeless population of what their needs are and how we could help them during the day. So what we were getting at was, Lincoln used to have a day shelter and they don't anymore. And we at CenterPointe kind of see that need for a day shelter. And then COVID came, and everything just got put on hold. And we really haven't had any talks about it, but I believe if we had a day shelter, it would give at least a chunk of these people a place to be during the day, to get resources, get food, get job information, get services to apply for Medicaid, or just hang out, just be whatever it is, You're still going to have people panhandling downtown, but I think it's going to alleviate, or it's going to take a big portion of those people away if we had a day shelter, and we'd have a lot less issues downtown, I believe. So that's a conversation that Topher has had and we've had. What was that?
I think you may be right. Giving them a place to hang out during the day. And one of the biggest things that we saw all summer is They bathe, sometimes fully nude, in the fountains at Centennial Mall,
Holy
right
news.
next to our museum. And maybe because it's further off from when college wasn't in session, it's not right downtown by the Capitol building. And they also wash their clothes in the fountain right next to the museum. And like I said, I think maybe because it's just, there's a lot less traffic. There's not a whole lot happening, past the museum.
Yeah.
And things like that. So having a place, like I said, for them to be able to do those type of things, that they could choose out in the public.
Yep. So the idea with the day shelter was, let's have it be as much as possible a one-stop shop for an individual experiencing homelessness. So they could come in, do their laundry, take a shower, get a hot meal, apply for jobs, or apply for disability, or get connected to resources, maybe have a peer support specialist there, maybe a crisis response therapist, and have it staffed during the day, during business hours. And we'd be able to, these people would have access then. People in the downtown area would have access to showers and food, so they would have somewhere to go. That's where they would go, because all they're trying to do is have their basic needs met. The same way as when they're panhandling. I know a lot of people think they're gonna take this money and just go buy alcohol or drugs, and I'm sure some of them do. But for the most part, to be honest, most people probably buy a pack of smokes with the money that they get, and then they go use it for food or a pop or a drink or whatever. I don't know. I really think a day shelter would be very good for Lincoln. The problem is obviously funding and who's going to pay for that. And I know Topher had started looking into that, looking into options, maybe looking at grants and things like that. And so, I've recently had a couple businesses downtown mention to me, hey, what if we put together some kind of fund or something? Now, I'm not naive enough to just sit here and ask you downtown businesses for your money to put together a day shelter, but I just want to get the conversation started. What can we do? How can we try to come up with a way to fund something, some kind of solution? Now, I know that's extra tough during COVID, because I imagine your businesses are struggling a little more because of everything that's going on, so I don't know. What do you guys think? Is there any ideas?
So one thing, if I may, is if there's time. I'm Tammy Ward. I know most of you, but I'm the council representative for Central Northwest Lincoln, and I was on the Point in Time activity, which was fabulous. And by the way, thank you to CenterPointe and to DLA for this workshop. It's been really fabulous. So thank you for all of that. But to your question, Cole, about a day shelter, I wish there was manna from heaven right now to do it. One thing I wanted to ask in that regard to this group, and specifically to you and Matt, Cole, and to DLA, one thing I hear a lot about from downtown businesses is, can we just have a public restroom for this population? That's all oftentimes what I've heard that the downtown businesses provide for this population. And then that's when sometimes customers or clients get uncomfortable with. And so what does that look like? And I see Councilwoman Sandra Washington has jumped on this workshop as well. And she and I have had discussions about what the city's part could be in that in terms of funding. So I guess to answer your question about how I would feel about a day shelter, it would be sort of a dream come true someday, and how we look at that, whether it's grant funding and city help as we get on the other side of COVID someday. And I'm not making empty promises. I just don't know how we fund it either. But it's certainly something that is a need. And so I was going to ask about how this group felt about just the public restroom aspect, let alone a day shelter. So thank you for bringing up that concept. And again, thank you for all you're doing. And I see Jeff Cunningham is on from the Haymarket, and Dan Sloan got off. So it does extend into the Haymarket as well. And I know we all know that. So Just again, thanks to CenterPointe. You are doing so much, and as is the DLA. And I've sat down with Anne Ringline recently, and she's amazing with the homeless population as well. So Anne, thank you for everything you're doing. And let us know at the city what we can do. I know it's limited, especially right now, but we will get on the other side of this again. So keep us posted. Thank you so much.
Boy, I think that sounds wonderful if we could have some kind of restroom, maybe a restroom with showers and lockers. Those three things would be huge for the population that Matt and I serve. Is Matt still on here? What do you think, Matt?
When the city shut down in March, or
Yeah,
I can't even remember,
End
when
of
the city
March.
shut down 20 years ago, this year, that was the first thing I noticed was individuals not having anywhere to go. And then it became like a situation with a lot more alley use as restrooms. I know in our neighborhood, the 13th and E area, we had set up a couple porta potties for people to use. And that's not ideal for a downtown setting because we had them like kind of pushed back and out of the way by a garage, so they weren't really an eyesore. But that would be something amazing if we could find even like an unused storefront that could, like, I don't know, substitute as like almost like an old bus station where there would be a restroom and maybe some lockers that people could just go in and use and then leave. There's also the issue then though of, are those individuals going to go in there and use it for other things as opposed to just the restroom? Because I know there was the company that rented us the units at CenterPointe. They were complaining that when they cleaned them out, there was always bottles and cans and stuff being thrown inside. So that would be the downside to things. But it would be huge. I mean, it would take away from a lot of people coming in asking to use restrooms downtown.
Yeah, and I think, Matt, I think you're right. I think that's where you and I come in, or whoever is staffing this shelter or building, storefront, whatever it ends up being. That's where we come in and build that relationship with the person and try to get the sense of community across to them as well. And hey, you know, this is your community, you live in it, so take care of it as well and throw your trash away or recycle, or you know, what can we do to make things easier for you so you don't have to throw your trash in here, or make your community trashier looking, you know, or just having those conversations with them. That's where you and I come in, Matt. But those are long-term relationships that we have to build, you know. You know that. I know you know that. So
I don't want
go
to
ahead.
keep anyone, and because I've got to go too, and I know Todd, you said this was over like 15 minutes ago, but when Cole was talking about coordinated entry and getting people onto that, there are, and I'm going to mess it up now. There's public doors, and there's agencies that actually enter the VI Spadat, and then agencies that do the VI Spadat, and it gets sent to one of those agencies to enter it. I can't remember the terms that CCFL uses to designate those. And I wish I would have said it earlier when everyone was still on, but if there are agencies or businesses, agencies and businesses interested in learning on how to do VI Spadats, I would love to check into that and see. That way, it's not just us making referrals. It can be people in the community also making referrals.
Yeah,
I know,
for sure.
I think it's Western Nebraska. There's a gas station that's been doing it where people can come in and get referred to the balance of state coordinated entry. But that's all I had.
Yeah, even if anybody on here know somebody that's homeless, you could always call myself or Matt, or give our information to the individual and say, hey, if you're looking for housing, this is a good person to know. You guys are all always welcome to send people our way.
Thanks, Cole and Matt. I appreciate you guys coming today. And does anybody have any last questions before I close this up today?
If anybody wants to chat afterwards or email me or call me, you're welcome to do that. I might not respond on voicemail or on call very quickly because we have this COVID response program going on and I'm getting a ton of phone calls right now. So maybe email would be the best way to reach me right now, but I would definitely like to keep this conversation going.
Yeah, this is great. And we'll send a follow-up email to everybody here. We've recorded this too, so we'll be able to provide this information to everybody that's interested. I think that's important. One thing I think I learned from this is how quickly we need to get an information sheet out there to our businesses so they can feel more comfortable and aware of these situations. And I know Matt and Cole can help us out with what to put on these cards, and we can certainly design and distribute. And I want to do that as quickly as possible. And yeah, also after this, we'll send an email with everybody's information and where to reach out to if you have any more questions, and continue the dialogue and continue this discussion as it's important for downtown and the community as a whole. So thank you, everybody.
Thank you.
Thank you, Matt and Cole. This was very informative. I learned a lot today. This was very productive. Thank you.
Thank you, Todd, as well.
Thank you so much.
Yeah.